Welcome to our video on snake bites. Here's a list of the topics that we'll be discussing for snake bites. Let's start with the clinical presentation. Now, snake bites will typically be found on the extremities as the snake strikes upward to bite a leg, or if the patient's upper extremity or hand is reaching down to the ground for some reason. So in general, just think of snake bites as on the arms or legs. Not all snake bites are associated with envenomation. So you may see some snake bites that just cause a wound with no further complications. Now, if the bite is from a venomous snake, there will usually be some associated puncture marks. And there may also be swelling around the bite site, and local regional lymph nodes can be swollen. There can also be bruising and petechiae. Now, the patient may also present with systemic symptoms, and those symptoms caused by the actual venom. Those include dizziness, sweating, diaphoresis, nausea, or fasciculations. Now, in this image, you can actually see the puncture wounds. Those are really what you could see after the patient has been bitten by a snake. You could also see some mild edema around that area. Now, at this point, the physician should draw a line around the edema in order to monitor the progression of the wound. Now, snake envenomation can cause a variety of complications due to the actual enzymes contained in the snake venom. Now, the patient may experience, for example, coagulopathy. And if it's severe coagulopathy, it can lead to disseminated intravascular coagulation, or DIC. Now, those venomous enzymes may also cause increased capillary permeability. So it can actually cause the patient to go into distributive shock. So naturally, hemodynamic instability. And if the snake venom contains something like neurotoxin, then the most likely target, or the most likely system in the body that will be affected and manifest symptoms, would be the neuromuscular junction. So typically the patient will experience cranial nerve deficits, such as ptosis, or difficulty swallowing, and those would be kind of the first symptoms. And they can progress over time and actually become widespread neurotoxic signs, such as muscle weakness, or worse yet is respiratory failure. Now, snake venom can also cause cardiac failure. And when examining a patient that's been bitten by a venomous snake, the first step should be to examine the wounds and mark the regions of any erythema or swelling or bruising. Like we mentioned, you really want to mark that so you can determine if it's increasing, and you can just monitor that progress. Next, laboratory testing is what you're going to want to perform. This includes a CBC, a CMP, and coagulation studies. Now, the CMP is valuable because it'll help you evaluate if the venom has caused any damage to vital organs, such as the kidney or liver. So you're going to get some liver function tests, and you can get the electrolytes to see if there's any changes there. So in other words, you're trying to figure out, are the kidneys and liver okay? And so you're going to want to get a CMP to know that. And the reason that you're ordering coagulation studies, such as PT, PTT, INR, fibrinogen, and D-dimer, is because you're trying to determine if the patient is experiencing DIC. Okay, if you suspect that the patient may have a foreign body, such as like a fang of the actual snake stuck in the wound, then it makes sense to also obtain an x-ray of the area. Now, when a patient comes in with snake envenomation, the most important first step is to keep the patient stabilized with supportive care. And that makes sense. If you're worried about distributive shock, you want to make sure that they don't have distributive shock. You keep their organs perfused and make sure they're hemodynamically stable. And that's fairly intuitive. You don't even need to know that the patient has been bitten by a snake to want to keep them hemodynamically stable. So support the patient. And next, you want to examine the margins that you originally marked. Remember how you saw the fang bite and around that you saw erythema or edema? Has that changed now? Next, controlling pain or giving analgesics is important because the patient can experience pain from the bite itself, or even just from the venom that the snake injected. So be thinking about pain and comfort here. Now, if the patient is experiencing severe symptoms of envenomation, then you can give antivenin. However, antivenin is not a benign intervention because it can lead to complications itself, such as a type 1 hypersensitivity reaction or even serum sickness. In fact, anaphylaxis is a common reaction to antivenin, and it's related to the amount of foreign protein or the purification method of the antivenin. So the point here is that antivenin is an option, but don't just go to it unless the patient has severe symptoms. Finally, do not attempt to put a tourniquet above the bite wound in order to prevent the spread of the venom. That's actually not something that's done routinely in the management of these patients. And why is that? It's because it's not effective. So you might remember from Boy Scouts or Girl Scouts that you want to suck out the blood or something like that. You just put your mouth on it, suck it out, or tourniquets. It's all been discredited. Don't do that. So here's a table that summarizes bites from snakes. And just so it's easier to review, this table also includes those details from other types of bites, which are discussed in other lectures. So you can refer back to this after you've viewed that material. Now let's do a question to apply what we've talked about. What is an important potential complication in the management of a zoo snake handler who's been bitten? Okay. In patients presenting with a snake bite, it's important to gather whether or not they've received antivenom in the past for previous snake bites. And since this patient handles snakes, and he's a snake handler, and he does that for a living, we can assume that there's a reasonable chance that they've been bitten previously and have actually received antivenom. Now, antivenom contains foreign antigens, so after the first exposure, antibodies are made in response. So that brings us back to this type 1 hypersensitivity or anaphylaxis idea. So after those antibodies are made, then if the body is re-exposed to those same antigens that are present in the antivenom, then you're going to be worried about anaphylaxis. So what's an important potential complication in the management of a zoo snake handler who's been bitten? You're worried about type 1 hypersensitivity reaction from the antivenom. And that concludes this section.